Hi, it's Bill. I practice divorce law at the Gentry Law Firm in Marietta, Cobb County, Georgia. This is another in our series of Lunch and Learn webinars about divorce law and how different aspects of our lives are changing because of the coronavirus and social distancing, as well as ways that we can make our lives better in this tough time. We expect today's program to run about 15 minutes in length. Afterwards, we'll be posting it on our YouTube channel, Gentry Law Firm LLC. At the end of the presentation, if you have any questions, you can put them in the chat box. Today, we're going to speak with Paul Mattson. Paul is a local physical therapist who's practiced physical therapy since 1987. Welcome, Paul.
Hi there. Good to be here.
Great. Paul, can you tell us a little bit about what a physical therapist does?
Well, we treat all kinds of conditions, medical conditions. I mostly specialize in orthopedics, which is having to do with your muscles, tendons, bones, from injuries to post-op therapy, try to get rid of their pain and get their function back to normal.
Okay. Well, what kind of training does a physical therapist undergo? For example, what kind of training did you undergo to become licensed as a physical? Because you are licensed by the state of Georgia, correct?
Correct.
Yeah, tell us about your training and so forth.
Well, I went to the University of Kansas for my bachelor's degree in exercise science, and then I went to Emory here in Atlanta for my master's in physical therapy.
And what kind of courses do you take, or is there practical treatment like an internship or that sort of thing?
Yes, you have all your anatomy, physiology, clinical skills, and then you do like 3 long-term internships or affiliations as part of your schooling.
Okay. So you've been licensed, I think you said, since 1987?
Correct.
All right. And where's your physical office located?
We're over here near Kennesaw Hospital in Marietta, Georgia, just a mile and a half from the square on 631 Campbell Hill.
Very close to the emergency room, the old emergency room at Kennesaw Hospital.
Exactly.
All right. Now, I know you've been doing this for a long time, long before COVID settled in about 3 months ago. In the pre-COVID days, what kind of patients did you typically see on a regular basis?
We got a good variety here. We see everything from plantar fasciitis and ankle sprains to knee injuries, total knee replacements, herniated disc in the back, the neck, just chronic myofascial pain, just from chronically injured muscles, a lot of arthritis patients, rotator cuff repairs, rotator cuff injuries, pretty much all muscle, tendon, joint injuries.
And now physical therapy, what are the, I guess, what's the term, treatment modalities that a physical therapist employs in doing what they do?
Well, we use all kinds of machines or modalities that help speed up the healing, like ultrasound, infrared light, low-level laser. We do traction. I have this machine called the HivaMat that's deep oscillating static electricity that no one else around here has, but a lot of pro sports teams have it. It helps flush out inflammation and swelling with static electricity. Then we teach people good posture, the right stretching and strengthening exercises, good body mechanics so they don't keep re-aggravating their back or neck. Massage, soft tissue mobilization, iontophoresis, where we can drive in some anti-inflammatory medicine if someone has tendonitis. But that's basically it.
Now, I know I've been one of your patients on a number of occasions for low back and shoulder and other issues. So when you are, you said you were driving in pain medications, iontophoresis, how is that done? You're not sticking needles into people in that way, are you?
No, we actually put the liquid form of the medicine on a patch, and then there's another patch, and we hook up a little electrical device that has direct current electricity, and it pushes the medicine out of the patch into your tissues.
Okay, so it actually kind of like topical application, but on steroids, not literally steroids, but.
Well, yeah, because the electricity just pushes it out, because like charges repel, so the current's the same charge as the medicine, and it pushes it out of that patch into your tendons.
Okay. Now, so are you seeing or hearing about new and different types of problems that have arisen over the last 2 or 3 months since COVID has been around and people are working from home a lot more and more sedentary?
Well, some people are gaining weight and some people are having, more neck and back aches and pains just from maybe using their laptop more at home versus their desktop at work. So, some of that's, poor posture over time and getting out of shape. So, we have seen some of that.
Well, let's talk about, for people who are stuck at home or spend a lot of time sitting at their desk. I know my wife has said that at times she gets up a couple times to go to the restroom during the day, but otherwise she's sitting at her desk from 8:30 to 5:30 every day. What are the things that people can start doing to ease some of these problems, maybe neck strain, back strain, and so forth?
Well, the main thing is to, get up and move around. But you can do some stretches at your desk, and you can do some stretches, if you take a 5-minute break to go lay down on the floor on your bed, to do some back stretches and hamstring stretches. But there's definitely a lot of things you can do at your desk, while you're sitting there stretching your neck and working on some exercises to help those muscles not get tight and fatigued.
Well, I see you're moving your head and neck around a little bit. Can you kind of walk us through a couple of good exercises or stretches for the neck?
Sure. Well, a good one, I'm kind of guilty of it myself right now because I'm kind of sitting like this forward, and then the back of your neck gets tight, your jaw juts forward. But I think I can demonstrate it better sideways. But you're going to do a chin tuck where you bring your chin straight back away from your fingers, and that gets your spine in more normal alignment, and it stretches out these muscles in the back because people get like this too much, and then your shoulders get rounded. So you can also, bring your shoulders back and get in a doorway. You can stretch that way. You can squeeze your shoulder blades together, for a few seconds. Do about 10 of those periodically. Side bending your head to the right, for about 10 seconds. Then slowly going to the left for about 10 seconds. Do about 5 or 6 of those, because these upper trapezius muscles get tight from kind of being shrugged up. You can also just turn a little bit and let your head sag down towards your armpit. That's a good one because it gets another muscle called your levator scapula that runs from your neck down to your shoulder blade along with this upper trap muscle. You just want to do them slow and gentle though, nothing fast. And you don't want to twirl your head around. That's kind of hard on the joints. For some reason, people like to do that. So some strengthening, you can get some bands. In fact, I can give a band to anyone that's watching this video and wants to stop by the office here, but you can put it out in front of you and squeeze your shoulder blades together. This wall is getting in the way, but you're just basically squeezing your shoulder blades together there.
So you're going like a full rotation to your arms all the way out at your side?
Yeah, you're bringing your arms back a little bit past your trunk, and that's going to use your shoulder blade muscles to strengthen them, and you'll stretch out your chest a little bit too. But you got to make sure you use an easy one. This one, people are kind of weak on this exercise, and if you use too tough of a band, it's easy to get sore. I made myself sore for a month one time by doing too many of those tough band.
Well, those TheraBands are the different colors are different resistance levels. Is that right?
Right. This yellow one's an easy one. Then they come in like orange, green, blue, black, gray. There's different companies that make different bands, so it's kind of hard to say exactly which one to get right now, but you can also loop this like over your doorknob, and you can do some rowing exercises to strengthen up your upper back and shoulder blades, because like I said, a lot of people get rounded looking down at the computer and everything. So you want to stretch out the front and strengthen the back.
Okay, so a lot of these are postural issues because, as you say, we tend to kind of hunch forward into the computer.
Plus, stress and fatigue. You can also, your hip flexors and your hamstrings also get very tight when you sit. So I can't demonstrate this one too good, but I'm going to put a picture of a seated hamstring stretch. That top picture right there, you're just kind of sticking your leg out in front of you and leaning forward a little bit till you feel a stretch in your hamstrings. And then this one down here, someone's laying on the edge of their bed and they're letting their leg hang off the edge there. That stretches your hamstring or your hip flexors that are in a shortened position when you're sitting all day.
Okay.
And also you could just stand up and do some squats, pump out about 10 squats to get your legs stronger and, get your heart rate going a little bit, get some blood flow.
Okay. Well, you talked about the head, neck, and shoulders. Are there other things for the low back? I know you talk about heel stretches, lunges. Is that something that's helpful?
Yeah, just you don't want to go too far, too deep, but if you stand, at your desk and maybe hold on to the side and do some partial lunges, just have your hand there just for balance and safety. And then you can also just slowly lunge forward, and that will stretch out those hip flexors in the front of your thigh that are, in a shortened position when you're sitting.
And just to explain, since we can't see that, you've got one leg behind you and one leg in front of you as you lunge. Is that right?
Right. Exactly. You're just on the stretch, you're just kind of going forward till you feel it stretching in the front of your thigh, and just hold it there for about 10, 15 seconds.
Okay. And then I know you've had me do some stretches that gave me a lot of relief to the low back, where you lie down on your back and you pull your knees up.
Correct. Yeah, I got some pictures here because I can't really demonstrate them too good, but you can do one knee at a time is good if one side's tighter than the other, but just, pull your knee towards your chest till you feel a little stretch, and be sure to keep your neck relaxed. Some people kind of tense up their shoulders too much. You just want to use your wrist and elbows to kind of pull your knee to your chest. And then you can lay on your back and slowly go side to side. That gets your rotators.
With your knee going side to side?
Yeah, both your knees kind of going slowly left and right.
Okay.
But it's good to lay down when you're sitting a lot, because your spine's getting compressed all day. And if you got some arthritis in your back, that can irritate your facet joints and everything. So it's good to, when you take a break, don't just walk around, try to go lay down and get off your spine and do some stretches. Then this one will get your buttocks area pretty good.
Okay, yeah, pull that a little closer if you would.
This one
okay,
right there.
Up a little bit. Okay. Yeah, okay, good.
You're pulling that towards your opposite shoulder, and that'll stretch some of your deep hip rotators that are deep in your buttocks area, that the sciatic nerve makes them tight if they've been irritated.
Okay. Now I think there's an exercise or a stretch called the bird dog.
Yes. Oh, I did not bring that picture with me, but that's a really good one to stretch or to strengthen up your neck, back, mid-back. You're going to be on all fours, and you're going to lift one arm and the opposite leg and hold it there for like 5 to 10 seconds. And that works your deep core muscles along with your superficial, posterior, body and your neck and back muscles.
And then you alternate with the other.
Try and do like 10 to 20 of those.
Okay. Okay. Any other stretches or exercises that may help?
Well, this is an easy one to do at your desk too. Just kind of pull your arm across your chest there. That stretches out your shoulder blades. Just kind of getting the blood flowing by doing some easy shrugs is good too, because you're sort of in one position a lot. We want to get the muscles moving a little bit in a safe way. But just
Paul,
you need to go out and walk and jog, and for your weight loss and stress, it's good to just, if whatever you can do, ride the bike, walk, jog, some calisthenics, anything like that to kind of get the blood flowing and burn off some stress.
Good. So motion's the lotion, huh?
There you go.
Okay. So how often should you get up and walk around during a typical work day if you're glued to the computer like people like me?
Well, I like to tell people every 30 minutes, but if you can mix up your exercises, at 30 minutes, just do, a couple rows and a couple stretches, then get back to work, 30 minutes, then get up and walk around and do some squats or lay down real quick. Just 2 minutes of something, can interrupt that tension that's building up and keep you from aching and getting so uncomfortable. But, the longer the better, of course, but some people just can't get away too long, but just 2 minutes of something can make a difference.
Paul, do you have any closing comments for our viewers today?
Well, I guess you only have one body, so you got to take care of it. And people would like to spend money on their cars, and they don't want to spend money on their bodies. So if you're hurting, come to a physical therapist or a doctor and see what we can do to help you out.
Well, there is something called direct access. Is that right?
Correct.
Tell us about that.
Yeah, legally now in Georgia, you can come to a physical therapist without a doctor's order like you needed to for a long time. And we can see you for 3 weeks or 8 visits, whichever comes first. And we can evaluate you and try and figure out what's going on and if we're nervous about something, of course, we'll send you to the doctor to get a X-ray or an MRI or get looked at by him or her. But a lot of people can nip something in the bud earlier if they come to therapy quicker instead of waiting.
Okay, Paul, we've lost your audio. Paul, we've lost your audio. Okay. All right. Well, I think we've lost Paul's audio, but we'll go ahead and wrap up.
Yeah.
Go ahead. Now, so what's your phone number there?
Stuff on my screen here for my connection here.
Okay. What's your phone number there, folks want to call?
Oh, it's 770-424-6787.
Wonderful. Very good. Well, you can reach us at the Gentry Law Firm at 770-425-5573 and visit our website at gentrylawfirmgeorgia.com. Please like and follow us on Facebook, Twitter, Instagram, YouTube, and LinkedIn for more updates. And please share this video with anyone who may need it. I don't see any questions in the chat box. So Paul Mattson, physical therapist, thank you very much. Venture Physical Therapy. That wraps up our presentation. Have a great day.
Hey, you too. Thank you.
Thank you.